Fit just the right amount of space. The scope, everything. It's just my perfect bag.
Alrighty. Let me kill the music here.
That was great music, by the way.
Oh, thank you. Can I go ahead and get started? Hello, everybody. My name is Juan Espinosa, Director of Student Success here at the UCLA School of Nursing. Thank you for joining us today for our fall quarter alumni panel. We are very excited that we have 5 great alumni here today with us. Oh, you can just pull a chair here.
Thanks.
Yeah. We'll go around for some introductions. Today we have Dr. Donna Krog. He is in nursing research and travel nurse. Dr. Krog is a double Bruin Nurse Alumni class of 2020. She obtained her MSN in 2017 and her PhD in 2020, both from UCLA. She's the CEO of Smart Forward, and prior to the COVID crisis, she was a travel nurse. As the CEO for a healthcare startup with the UC Noise grant, she's a co-investigator and CCRN. We also have Stephanie, right? Stephanie Fan, she is in MedSurg ICU, RRPACU, graduated from the MECAN program in 2015 and started her nursing career as a new grad in NYC at Mount Sinai in MedSurg. She came back home and has been at UCLA since. She's worked in the SMICU and ICU float pool, and now RRPACU. We also have Justin Palisbo, UCLA Macon graduate class of 2023, BS in Healthcare Administration from CSU Northridge. Justin specializes in medical surgical nursing. He is currently an active duty Navy Nurse Corps officer stationed at Navy Medicine Readiness and Training Center, Camp Pendleton. Hi there, join us, grab a seat. We also have on Zoom, we have Julie Daniels McCurdy. She's a proud UCLA Macon program graduate. Macon is representing today, y'all. Of 2019. After graduating, she worked as an RN at Long Beach Memorial Hospital from 2020 to 2024, with most of her experience in the adult ICU. And we also have Megan Wesson. Megan Wesson is a nursing professional development practitioner for the UCLA Health Center for Nursing Excellence. In this role, she oversees student placement, preceptor development, and professional governance for the UCLA Health System. Megan has 5 years of clinical nurse experience in cardiology, progressive care, and critical care. She has been a clinical instructor for fundamentals and med-surg rotations for Santa Monica College, ADN and BSN program, and the Cal State LA traditional BSN program. Awesome. All right. Thank you and welcome everybody. So we're just gonna go around the room and have the alumni say a few words about themselves. So we'll start off with Megan.
Sure. Hi, everybody. So like Juan mentioned, I graduated from the MECAN program in 2019. I have clinical background in cardiac. I was in a step-down telemetry unit at UCLA Ronald Reagan for the first 3.5 years, started in their nurse residency program. So highly recommend that for anybody who's interested. And then I graduated up to the CCU, so one of the cardiac ICUs at UCLA. And then just really loved teaching, really loved sharing the wealth of knowledge that I had and really just developing students and other members of my staff. And so just was really looking for a more like teaching and educational role. That's when I dipped into the clinical instructor realm, which I absolutely loved. And now in my new role, I kind of touch on that a little bit with student placement. So when you guys all start or have started rotations at any UCLA facility, that goes through me.
Oh, yeah.
So we'll see all of your names, I'm sure, very soon. But then I also developed the preceptors, so those nurses that take you on as nursing students and are your preceptor and train you on the unit, et cetera, either as a student or as a new grad, or if you got hired somewhere else and then decided to come to UCLA, they would train you as well. So I developed their preceptor skills. And then professional governance is a great opportunity as well at UCLA. So we have a lot of different professional governance councils, which is really just designed to have a shared decision-making model where we're bringing decisions to clinical nurses. So we really want to hear the voices of clinical nurses to raise concerns, raise ideas, and actually get those ideas implemented at a system-wide level. So it's not just all management and leadership making decisions, it's clinical nurses as well. So everything that I've done in the last 5 years have really kind of landed me in this position. So excited to be here.
Yay. Thank you, Megan. Dr. Krog.
Nobody ever calls me that. I like that name now. I remember. So I started volunteering when I decided I wanted to advance to from my bachelor's. So I did 2 years as a volunteer because I had worked as a travel nurse here in the PACU in the old building before Ronald Reagan, back in the basement care unit in the PACU. And yeah, I was volunteered as a PACU nurse in the Ronald Reagan. I would come in at around 4:30 in the morning and just kind of greet people and weigh them and give them a gown and help them reduce their anxiety. And I did that for 2 years and worked with Dr. Catherine Carpenter, who's passed away, which I don't know if any of you have had her class. She is my co-chair. I just adore her. And such a brilliant woman she was. And she let me be a volunteer for Department of Human Nutrition, and that went alongside with my dissertation with alcohol use disorder post-bariatric surgery patients. And then when I volunteered for 2 years, I got some really great letters. And that really helped me to get a segue into this wonderful school, which I just thought I'm not smart enough to be here. But I found out in one of the information sessions, which the director of research at Cedars-Sinai, she was there for an information session, and she just said, if you're passionate, if you're driven, if you work hard, you can do this. This isn't about an intellect. And I just thought, I am all those things. And I did get the PhD. So I was really grateful for her words of encouragement on that information day. So I make sure that I come to these panels to encourage and to let you know that no matter what you feel like, no matter how much you think inside that you're not as smart as you think that everyone else thinks that you are, that as long as you're here for the motives that I just presented, I think that everything's going to be okay. And when I graduated, I was teaching here for 7 years. That's how I lived on campus.
Yeah.
Great dorms, by the way. I think I had purple furniture. It was really cool. And I taught the whole 7 years. And then COVID hit our last year. So I just went back into travel nursing and helped with the COVID crisis. Did that for 3 years. And then I kind of touched with Addie Nyamuthy, who was my chair before she got promoted to UCI School of Nursing. And her and I did this grant together. I told her about my company and how I want to take care companion robots to mitigate agitation. And so instead of having people 24/7 or putting our loved ones in these ADLs or memory cares, that maybe we could promote creating little boxables in people's backyards with a care companion robot that's its eyes and ears. And then we hope, well, our research is on mitigating agitation to reduce falls, but we hope that it also help with loneliness. And that was something that I saw. So that's my company, Smart Forward. So we're in our 1 year. We just had our annual meeting yesterday. So.
Awesome. Thank you. Justin.
Okay, so as Juan said, I just graduated in 2023, and I actually just graduated my new grad residency program last month. So before nursing, I do have a bachelor's in healthcare administration. So I worked at Kaiser before, and their permanent anti-medical group. I was doing project management and consulting, and then it wasn't just fulfilling for me. So a lot of the nurses that I was working with at Kaiser kind of suggested nursing, but for me, I was like, there's no way I'm smart enough, to do nursing and all that. So, I did volunteer as well. I was over at St. Mary's with the Cope Health Scholar Program, and then at the same time, I was working as an EMT. And then COVID hit, and that was a very big learning curve. And that was just a crazy time if you've ever worked during that time in healthcare. And from there, I think just the EMT experience, just getting involved in, people's health and kind of understanding how things work, just really opened the doors as far as opportunities. I've had various contracts with Department of Homeland Security when COVID was going on. tracking, especially there's a small Ebola outbreak that happened in 2021. So I was doing some work with the CDC during that time. And then I finally got into nursing school, and I was still working as an EMT during that time. So schedule was pretty hectic at the Meccans. I know first years, but just prepare. It gets a little chaotic later. And then after graduating nursing school, I actually worked over at the VA across the street at their new grad residency program for about 6 months. And then I had to leave during the middle of that program because uh, was appointed to commission as a naval officer beginning of this year. So I did leave the program, and I went to officer training command, graduated from there. Did my first Navy medicine orientation at Walter Reed National Military Medical Center in Bethesda, Maryland. And then now I am in med surge over at Camp Pendleton.
Very cool.
Awesome.
Awesome.
Thank you for time.
Hey, Justin.
Mhm.
Stephanie.
Yeah, hi. I graduated Meccan in 2015. It was my second career. I was like in something totally unrelated before that, like marketing, startups. So if you're doing a whole career shift or you didn't think you'd be a nurse when you're young, it's totally okay. I actually feel like having the experience outside of nursing really helped me be a better nurse and gave me more maturity than if I had like kind of gone into it in the beginning. And as I mentioned, what's it called? I went to New York right when I graduated. So that was a fun and interesting challenge. I don't know if any of you guys know, but like in California, there's nurse ratios.
Yes.
Outside of California.
I came here. Yes.
That was quite a shock for me as a new grad going to Mount Sinai, which is a very, very busy hospital right in the middle of Manhattan, having 8 or 9 patients at once versus like 3 or 4. So it's a totally different scale, different game. But if anyone has questions about nursing outside of California, I'm happy to answer those. Really good challenge. And then came back to UCLA because UCLA is the best. For those of you that worked elsewhere or, gone to clinicals elsewhere and then come back to UCLA. UCLA really is an amazing hospital to work for. It's very hard to leave. But I've been kind of all around. I worked in Santa Monica in the ICU over there and then ICU float pool. So I've kind of seen all the ICUs and most of the floors here in Westwood if you guys have questions about that. And then now I'm in the PACU because I got tired of ICU.
Oh, you're
Sick zone, and that's lovely.
Yeah. Thank you. Thank you, Stephanie. And we have Julie on Zoom as well. Go ahead, Julie.
I want to follow all these amazing people. You guys have all amazing stories. I like Megan. I'm a 2019 Meccan. So again, Meccans can you hear me okay? I should have asked that first, I guess. Okay. Second, actually important question is, can you hear my daughter's Coco Melon? Because she's not napping and is sitting next to me. Okay, perfect. And I also, being a Meccan, my undergraduate was actually in marketing as well. So representing the marketing there too. I thought I was going to go to med school and I became an EMT to kind of like get my toes wet in healthcare. Loved being an EMT. I worked 911 for about 5 years and then got into nursing school instead because I decided I did not want to go to med school. I wanted to be able to spend more time with patients instead of on the kind of medicine side. After Meccan, I thought I was going to go into emergency medicine, but I ended up in the float pool at Long Beach Memorial, which actually ended up being great experience. And after a year, I transitioned into the ICU. And currently, I have put the thoughts of how horrible it was to be a grad nursing student way out of my mind. Too far because now I'm back in grad school, getting my DNP as a CRNA. But it's all coming back to me now. So I'm about halfway through my DNP, and I'm in Maine now to complete that program. I do technically work for UCLA still. I work at the Center for Pre-Hospital Care, where they do a lot of like EMT training, paramedics, and then like BLS, ACLS, PALS, that sort of thing.
Great. Thank you, Julie. Alrighty, everyone. So we're gonna go ahead and dive into the questions. So by the way, these are questions that our students submitted. So these are all questions that our students want to hear more about. For the first one, how do you make yourself a competitive applicant as a new grad? we'll go around the room. How about Megan?
Sure.
Me-
I think this is a tough question because everybody is so unique. Everybody has different individual aspects and strengths that they bring to the table. I think what Donna was saying earlier about just kind of like showing your passion of like whatever that is. Um, some people in the MECN program, and I can only speak to the MECN program because that's what I was in. But some people worked while they were in the MECN program, other people didn't. I did not, I nannied, right? But then I was able to then get involved with different student organizations. Other people in our cohort, Julie and my cohort, then did like the Care Extender program. So I would say, regardless of whatever you want to do, just make sure that you're passionate about it. I would say diversify your resume besides just school, because everybody is doing school, right? Like I don't want you to not prioritize school, right? So make sure that you're like getting good grades, make sure you're able to keep up with all of your assignments and excel, but make sure that there's something a little bit more, and it doesn't even really matter what it is necessarily, but like make sure that you're passionate about it. And I would say also for any of your clinical experiences, you guys are lucky to be at UCLA School of Nursing because you have the immersion program, which a lot of schools don't have. And luckily, UCLA Health then places a lot of you guys. So I would just say, like, really utilize your connections that you make on the floors, especially, well, in any health, any facility that you're at. Make connections, go up and meet the managers, go up and meet the charge nurses, be professional, have, professional behaviors, make sure that you're networking with people, show your clinical competence, show your communication skills. Because like people remember that. And as a clinical instructor, I taught for Santa Monica College and Cal State LA and rotated both through UCLA Santa Monica and then Cedars. And I had multiple managers come up to me and said, like, we are going to keep your students on our list if they're looking at the new grad program because like, 1, 2, 3, and 4 were very impressive and we would love to hire them if they're interested later on. So it's like every single moment that you are in that clinical experience matters. And so just present yourself in a way that you want people to know you, right? Be real, be authentic. And then just show your passions when you're moving forward.
Cool. Thank you. Dr. Krog.
To answer the same question?
Yeah.
Well, I I agree with everything, but I also want to add that I think that all nurses are
Bless you.
scientists and that you don't have to be a nurse, but if you're in the arena of the nursing school, you already are a scientist in that field. You don't need a degree. So I would say to reach out to all these wonderful, wonderful departments with all of these great publications and see if something interests you and then get to know those scientists and then work with them for, volunteer with them and see what drives you, what's passionate. And then from there, it's just like, there's this wonderful collegiate, thing about UCLA, I mean, we're 100 years, we're like the #1 public research university in the world. We're amazing scientists are here. And so what I believe is what I did, which was to volunteer, even though I was already a nurse. I just think that had I started that way, just seeking out people that are doing great research. I mean, you can go on Google Scholar and just hit a couple points of things that really passionate about. A lot of the students that told me over the 7 years was that their sister had died or their father got really sick. And I heard these wonderful gut-wrenching stories that brought them here. And so I just encourage you to find that and reach out to all these incredible scientists here and see if you can get in and just, I mean, I did brain mapping. I did all kinds of stuff while I was here for free. I did not work because I just lived off of my student loans, which is like 215,000. I have no idea. Babe. But I feel like I've given back, and this research I'm doing is my way of giving back to the elderly. Because honestly, you students were like, it smells in these ADUs. It smells like urine. The food looks horrible. And I'd be like, there's got to be a better way to treat our elderly. Like, this is wrong. And so it was you guys that gave me a new passion for a different direction. So even though I consider you scientists, even though you haven't even graduated yet. So just remember that. And then the other thing I would say is that I went home after every single clinical, and I would rewrite all the diagnoses, and I would think about my patient, and I would think of ideas that I would talk to each particular doctor about and say, I should have got an order for this, or I should get an order for this, or I should get an order for this. And that would build my critical thinking, even though I wasn't even, and I was just in school. That really helped me learn and be an amazing critical thinker. Because when COVID hit, I had no idea how to help them. And I thank God for my critical skills. So, but I was notoriously the one who transcribed all the notes from, I recorded all the professors. I had books like this that were all my transcriptions. People bought my notes, but I'm just passionate about learning. And I got into cardiac because I didn't understand preload and afterload.
Yeah.
And I said, please. And I was in Florida where we had 10 patients and the neuro stepped down and the ortho stepped down. So I get it, but I think that when you're in school, if you could really take the time at home to go over your patient and figure out what you would have done had you been the nurse, I think it'll really intrigue. And now you have ChatGPT 4.0, you can ask her or him or neutral, whatever, but you can ask and they'll give you like stuff that makes you smarter. Really, I didn't know that. Oh, this study, and they'll ask you, if you ask ChatGPT, if you ask that to give you references to what that diagnosis is, it will give you reference. Well, it'll hallucinate, so make sure your references are really there because it does hallucinate. But anyways, that's what I would do. A little bit different than her answer, but
Thank you. Switching to a new question. For Justin, how would you describe your work-life balance as a nurse?
Oh,
yeah.
it's gonna be a little different for me. Since the military, it's very there's a lot of work. So as far as like nursing, I do have a typical schedule where it's 3 shifts 1 week, 4 weeks the next, but that's just the nursing shift. And I have all my officer duties, so I might be in charge of, training or charge of education. It varies from week to week, but what I can say is I think the attitude that you bring to the unit will help you keep you balanced. Try not to bring work home and problems at home to work because it really messes up kind of the dynamic of your of your work area and with your coworkers too. But definitely self-care is something that needs to be approved on in the military. So this is a bad question for me. But I do try to balance, trying to, I mean, even coming out here, I drove from San Diego because I'd rather, get out of the area and kind of clear my mind type of thing
Yeah.
versus, staying in Zoom. So yeah, that's all I could say. Yeah.
Thank you, Justin.
Uh-huh.
How about Stephanie? Same question. How would you describe your work-life balance as a nurse?
Yeah, I think it's different for everybody, and I think you just have to do what works best for yourself. Like for example, so I'm currently in PACU. My shift is swing shift, so it's 2 p.m. to 2:30 a.m. And I think everybody there thinks I'm totally nuts for taking this. It's such a weird time, and it doesn't work for most people. But like my husband is a night owl, so we actually are on very similar kind of like awake asleep hours. Like we sleep in, but then we also kind of stay up much later than normal people. And I think it's okay to kind of just find the slot that works for you. And it depends like what is your partner situation? Do you have kids? Like there's so much that comes to play. And sometimes it's a matter of trying things out. Like I've tried day shift. I didn't like that very much. Like, I was on night shift for like 9 years, 8 years. That worked really well until it didn't. So it's also okay to like things can move and change as you go along through your career and your life. But for me, I found that 2 to 2:30 works really well. I feel like I'm not a total zombie during the day anymore. And then the other thing that I would say, especially like if you have, again, family partner, is holding boundaries. So like when I was on night shift, I was obviously gone 3-4 nights of the week. And so for me and my husband, it was like, every Sunday, we do not make plans. Like it's just going to be us and that's it. Like we're just going to straight up just turn down anything that comes up, and like doing that is just like an important way to reconnect. So like kind of finding that, making sure whatever space you need in your personal life, just hold firm to it. And it's okay to say no to people. It's totally okay. And if that's better for you, that's great. Do it. So
Good idea.
yeah.
Thank you.
I might use that one.
Julie, same question. Work-life balance as a nurse.
Joy.
So I no longer have any work-life balance.
Yeah.
I will say, one thing I actually, I had a baby as well, right? The last in a year and a half ago, which also doesn't help work-life balance. But I do feel like one of the things is that you have to give it some time to settle out. I remember like when you first start, you're just stressed all the time and you're like, this is just as bad as nursing school and it's never gonna get any better. But everything settles and then you realize that you have the time to take care of yourself. So I would say enjoy that time. Enjoy that time while it's there. Don't take it for granted. But anything that you can do, even if you're exhausted, to just keep your relationships strong. And this is in school too, right? This is not even just as a nurse, but keep your relationships as strong as you can. You know, do any self-care that you can, because all of those things are going to help you in school and they're all going to help you at work. And don't have a 2-year-old, and that will help with your work-life balance.
Thank you, Julie. That was great.
I think she was saying me.
I love that. I love the authenticity. For our next question, and we're gonna mix it up a bit. Whoever wants to take this one, what advice do you have for students who are looking to go into your specialty? Who would like to take that one? Victim or volunteer? How about Justin?
Okay. So again, med surge. I know, there's no one wants to go into med surge for some reason. And during my program, I was asking, everyone wants to do the cool specialties like cardiothoracic, ICU, all that stuff. If you are thinking about med surge, I mean, you're doing some of the skills now. Time management is a big one. Just learning how to talk to people, how to prioritize. So those are the top 3 things that I'd recommend start working on now. I mean, if you're just starting in the MECA program or BSN, you'll start developing those skills as the year goes on. So
Thank you.
And
I
don't
am.
talk on med surge. Like
Yeah.
most nurses end up on med surge at some point in their career, right? Or even start there, and you learn so much. So I feel like that's obviously not a popular specialty when you're coming into nursing school. Like, like Justin
Yes.
mentioned, you're going for like pediatrics or OB or whatever, but just always keep your mind just an open mind going into all of your clinical rotations. I've heard like, don't go in if you're like on your psych rotation and be like, I don't want to be here anyways. Like psych is not my ideal thing. That gets around, right? So just kind of like be really open-minded with everything that you go into for any rotation, because if you have your mindset on something at the beginning, it might end up changing by the time you graduate. For nursing education and nursing professional development, I would just say that like any opportunity to teach or to educate or to professionally develop yourself or other people around you, your peers, to mentor people, all comes into play. So when I was a Meccan, I did I don't know if they still have it, but like the Skills Lab mentorship program, where like the 2nd-year Meccans can sign up to be mentors in the Skills Lab so that they can like help you practice doing like Foley insertion or whatever, so that more faculty members don't have to be there. So like that's where I started, right? Was like teaching from and mentoring from the get-go, and then being a preceptor on my unit and teaching in different capacities within our professional governance structure at UCLA. And so I was able to like bring all of those experiences to then promote myself then when I was interviewing for this job just, in the last 5-6 months, to then show that I was like ready for this new role.
Dr. Kroon.
I was just thinking about the simulation. Like I loved getting certified in the Sims lab because I got to learn so many different skills. And that helped me to get more in critical care. But when I first started nursing, I quit nursing after a year because I was at a trauma 1 and I went to the ortho step down, neuro step down. We had 10 patients and I would float to MD Anderson. I'd float to the ER. I would float on my days off, and the nurses would bully me about, you don't know what you're doing.
Oh.
you shouldn't be doing that. And I said, but I do know what I'm doing because I just studied the NCLEX for like 8 months, 5 days a week, sitting at a computer, wondering why I got something right, why I got something wrong. I do know a lot more than just neuro and more than just ortho, and I don't want to lose it. And the only way I know how is to start floating on my days off. And after my year, I just quit nursing. And I just thought, gosh, like they didn't want me to learn. And I thought, I guess I'm going to just go back to being a technical writer because I work for the CDC as well and the DOD. And so somebody said, you should go do critical care. So I just encourage floating. I think it's a great thing because you just learn so much. And they're always really respectful. Even MD Anderson, I could maintenance the chemo, but I couldn't start it. And, that was good. I learned so much there. And then you also, psych. Oh my gosh, like I never thought I'd be good at psych. But I really like I was very open-minded. So that those are two things I encourage.
Thank you. That was Stephanie. Let me repeat the question.
Yeah.
What advice do you have for students who are looking to go into your specialty?
It doesn't take students, but in general, I think it was like what you guys were saying, like I feel like when I was a mech in UCLA, the professors really, really pushed this idea of like ICU is end all be all. ICU is the most elite kind of nursing you can do. And I just, as I was in med surg for a long time, it's so not true. And I think they're very different skills and they're both super valuable. I can say that I see ICU nurses get floated to med surg floors, which can happen, and have total meltdowns because like, why are all my patients talking to me? Why are there so many? So I think med surg is so valuable for learning time management, just talking to a lot of people, getting exposure to a lot of different kind of like medical, surgical issues. ICU is also great. I think just in general, being super flexible. And I think that's when you go interview, that's something that your employees want to hear, employers want to hear too. Do you show yourself as somebody that's flexible, willing to learn, and okay taking like criticism? And that's all part of like the learning process. Because I think employers know when you're a new grad that you don't know anything really, you know what I mean, in terms of like clinical practice. They know that they want to see more of like your personality type. Are you going to be a team player? Are you be flexible? Are you open to really work on yourself and grow?
Yeah. Thank you. Thank you for that. How about Julie on the Zoom?
So I thought I was going to emergency room nursing, and it was like the end of the world for me when I couldn't get a job in the ER as a new grad. Um, and and so like everything that people are saying about be flexible, be open is so true. So I did get hired on the Long Beach Memorial Adult Float Pool, and you get a lot of experience that way. And then I stayed in the float pool for a year, and I really liked it there. I think I get a little like restless, so that's why I move around and I went to ICU. But I feel like my experience in the float pool was amazing. You meet so many people, you learn how to work with so many different personalities and so many different patient types. And honestly, after working in the ICU, now since I started in float pool, I could probably go back to med surg if I needed to. But if I had started in ICU, there's no way that I could go down to med surg. No way whatsoever. Because it really is a different skill set, and like you have to prioritize in a different way. But so I think you do really have to be flexible and open, and just realize that any experience you get, if you're like truly into your specialty, it's going to get you to your specialty no matter where you start.
Great. Thank you all for that. For our next question, how did the UCLA School of Nursing prepare you for your job as a nurse and as a new graduate? Megan, what do you think? That one?
Yeah, sure. I think clinicals are so valuable. And I didn't realize this till I met other nurses that went to other nursing school. Like other nursing schools will have students figure out their own clinicals or not offer them. What UCLA does in terms of setting up your clinicals for you, making sure you get to not only different types of hospitals, but different floors is really a very, very valuable experience that you just don't take it for granted. And one of the things that I think that is helpful as you go through your clinicals is keeping a diary or a journal of when you have particular like just kind of standout experiences or days with your patients, because that'll be really helpful for you when you interview later.
Yeah.
If you can have your stories, because you think you'll remember,
No.
but everything's a blur and you won't. So even if you just jot down like, this woman, like obviously nothing too specific, what the conditions, and not only their clinical picture, but also what you specifically did. So like, for example, when you go into interviews later at whatever hospital, they're going to say, give me an example of a time that you advocated for a patient. You can flip through whatever your notes are and say, oh, so think about that. Like, you want to write down like in your journal, the times you think you've advocated for patients, maybe times that you may have disagreed with the doctor, or if you had like not conflict with the doctor, but like an instance of conflict, like stories like that you can use in your interviews later. You just want to be able to pull from those from your clinicals, because other students that are also, or graduates that are also applying, might not have the same experience as you did. So really, really take advantage of the clinicals, because I thought that was like the best part about UCLA nursing school. Yeah.
Great. Thank you for that. How about Megan?
I loved our cohort. We were a very close-knit group of people, very supportive. And so I feel like the School of Nursing provided that and fostered that like supported learning environment for our class. What comes to mind beyond the clinical aspect, because that is super helpful. And now that I place students, it's amazing the amount of requests that I get that I just cannot fill. And I'm just like, I don't know what these students do. But anyway, when it came to like preparing to graduate and preparing to apply to a nurse residency program at any of the amazing hospitals, right, that are in the LA area, name them, UCLA, Cedars, USC, Keck, CHLA, like, right, all these hospitals that are just so high on everybody's new grad list. When I graduated from undergrad at UCLA, I got my BA in history. And so, sure, we all graduated at the same time. We were all trying to apply to jobs at the same time. But I wasn't actively competing with my direct classmates who I saw every single day. Like, we weren't going for the same jobs, right? So this is like an interesting situation, because your cohort mates, you are applying for the same jobs. And so like it can get really competitive, right? It gets awkward, it's stressful. So I just want to prepare you for that. But I think that that environment of like support is that our class actually like collaborated to put a Google Doc together of like when all of the new nurse residency programs or new grad programs were starting in Southern California, and deadlines and links and everything. And we were just supporting each other through that. And would we may have gotten there on our own? Maybe, but I think that like the School of Nursing really just helped create that, the collegiate environment, the collaborative environment, that made that part a little less stressful and a bit more supportive from the whole group.
Dr. Crush?
I didn't hear the question.
Oh.
Because she was leaving and I was gonna say, oh, I hope she has our numbers if she needs
Oh,
it. Or our emails.
Yeah, I can say.
So what was the question?
How did the School of Nursing prepare you to work as a nurse and a new grad?
Goodness, because I was already a nurse, it prepared me for research.
Oh, there you go.
So I did the master's thinking that I can do a fast track, accelerated in 3 years and get out of here, which is exactly what I did, except it took me 4 years to do my dissertation study because I got to use all the data. So, I did a startup with my own idea and got a grant with, by the way, Addie Nyamathi is what they give her, the Lifetime Achievement Award, 50th anniversary. And she's my primary investigator of an idea that I had. And I'm like, how did I get here? So it prepared me for writing research that is on the Noyce grant, which are only for very high risk studies that most people aren't going to fund, give you a grant for high risk, and severe dementia patients are high risk. Working with them is difficult, and they're nonverbal. So we're training this robot to read emotional AI, which luckily my husband's chair of AI at Pepperdine, so he does work for me. I'm sorry, probably would not like that if he heard this. But the org chart has me at the top, okay? But that's terrible. But anyways, I guess in that respect, it did prepare me because I always knew I was a scientist because I was always thinking. I was always fighting policy change. Like even as a parent, I was going up to Capitol Hill and like, you should be, your childcare is stupid, you don't understand. You would make our children go to these cheap places. I talked to my House of Senate, my House of Representatives. So I felt like research was just my thing, especially policy change, which I'm really good at fighting for because I'm passionate. So for me, I don't understand the question could have helped me other than if you're looking at the research arena. And let me tell you, research is not about money. I mean, I've been doing this research for 3 years and I've never made one dime. It goes to all the PhD students, all the postdoc students, which is why I still work, to fund that. But when you work hard as a nurse for as long as I have, you have to give back because that's really happiness. Like giving back is just the ultimate joy. I love what I do. And yes, I do hate that I'm in debt. And I hope God forgives me. But I feel so grateful that I get to give back. So I hope that you guys will go further and get your PhD because it's so rewarding. Like, oh, I can't tell you.
Thank you.
You know how much I love it.
Yeah, we can hear your passion. That's great. That's amazing. How about Justin?
Okay. So I think what set me apart on a lot of these new grad programs was the research aspect. Especially when you do your evidence-based project towards the, closer when you graduate. So a lot of schools, they actually don't teach their students a lot about the evidence-based project and how to set it up, how to ask the right questions, how to do surveys. But a lot of new grad programs actually require that towards the end when you graduate. And then once you get onto your unit, there's that expectation that you're going to contribute something to the unit. And how do you contribute? You do your research-based project if you need any change or anything like that. So I think that was a big thing that UCLA School of Nursing, definitely taught me.
Good. Thank you, Justin. How about Julie and Zoom? On Zoom.
Some of the things that were already said are things that I had actually written down for this question because I was preparing as a good student, right? But I agree about the first thing that I think Stephanie was talking about with the clinical experience. You a big part of once you go into your career will be just learning how to work with different personalities and different types of people. And you're already getting that experiencing by going to so many clinical sites. And then on top of that, again, I had this written down too, the idea of writing down some of your experiences. A lot of interviews are starting to go towards that behavioral based interview questions. I think they call it like BBI, where they ask those questions like she was talking about tell me about a time when XYZ. And if you haven't been remembering and writing these down, and even like you take your experience and kind of like rehearse it a little bit, like make it pretty, put it in a nice package to give to these interview people. If you don't have those experiences to start with, it's really hard for you to answer those questions and to be able to stand out in your interview as a good candidate. So definitely write down your experiences, good and bad, because they will all help you in your interview.
Thank you, Julie. For our next question, what networking opportunities help you get your first new job as a grad? It's a new grad, your first job as a new grad. So networking opportunities.
I can add to that. So when I quit, that first year, and somebody said you'd be really good at ICU. How was I ever going to get into ICU? I quit, right? I had only been stepped down. So I found this wonderful program. It happened to be at UCF, which is like it's the largest school in the nation in Orlando, Florida. And they had this accelerated RN to a bachelor's program, where you could like get your ADN to a bachelor's. It was just 1 year. And the lady who taught the lady who wrote the book on critical care taught the class as an elective in the summer of this curriculum. And I thought to myself, I wonder if I'm going to get put into an ICU. And then when I get there, am I going to be like really showing them that I'm a good nurse and that this is my forte and that they should hire me, right? And I gave up nursing for a whole year with this idea in mind that if I study and work hard and I really listen to this elective class that was going to be taught in the summer after I've been there a whole year, that maybe I could get an A and I could really like spark someone to want to hire me and then see if I'm good in ICU. And it did turn out, but it was a long year and but it was my resourcefulness and my thinking that said, hey, if I do this, this, and this, it's like a short-term goal to a long-term goal. And then I ended up after 1 year getting to be a travel nurse, going all over the world. I mean, even to other countries, Dubai, Kenya. I mean, it was amazing. So I'm so grateful that I had a goal when I left, that I didn't just give up on nursing, that I found another way. And so I just encourage you to think outside the box and find your way and your niche and then work towards that goal. I love setting short-term, moderate, and long-term goals for myself. And I'm always having them. Once I achieve them, I find another one. But that helps.
Great. Thank you. How about Stephanie? Networking opportunities that help you get your first job as a new grad.
Yeah, I will say, well, this wasn't for me because I moved to New York, but for my class, think of your immersion time as like a 12-week interview. So many of my classmates ended up working at the unit that they did the immersion on because that's your chance to really like get to know all the nurses that work there, because you usually have panel interviews and also the managers and that sort of thing. And then for myself, what was actually very surprising was I went to New York. I didn't know anybody. I didn't even know what hospitals. I was just kind of applying, wasn't really getting anywhere at first. And I think networking is really important in the sense of like, I ended up getting in the door through my old high school friend, her college roommate, who she didn't even really talk to that much or know anywhere. She's like, oh yeah, she, I think, works at Mount Sinai. I bet she'll meet you for coffee. I was like, that's crazy. She's not going to want to talk to me. I'm a total stranger. She's like, no, here's her email. Just try it. And I was like, you know what? I have nothing to lose at this point. So I sent an email. This girl was so nice. She's like, send me your resume. We met up. We had a long conversation. And she was the one that put my resume in front of my manager's desk. And that was where I ended up getting hired. So my point to that is just, don't leave any stone unturned. Even if you don't think it'll work, it really doesn't hurt to shoot people an email, reach out to them, because you really never know. Like, I'm still shocked that that's how I got my first nursing job.
And Mount Sinai is pretty impressive.
Yeah, it's a hospital. It's a huge hospital, man. And so, yeah, I would say that's my advice. Just like, don't be afraid to ask people, because so many people are like, oh, I know a nurse that works here. Use your connections, even if they feel loose and like that they won't be worthwhile. It just really doesn't hurt, because your first nursing job's the hardest one to get, and then on the bright side, after you get your first one, it becomes much, much easier. So.
And nurses are nurturing. They really are. And he touches them and to help. They love to help. I mean, I believe that.
Right. Yeah. The girl I met with, she did not know me at all. She was so kind and so helpful. And so just, and then again, like I, on the flip side, try to always like pay it forward. And like, if I hear about other nurses that are, looking for a job or whatever, just want to talk, like, I'm so happy to do it in the same way. So.
Thank you.
Yeah.
But Justin.
As far as the networking, so definitely the immersions. So when I got the job or the new grad residency over at the VA, I did some clinical rotations there and kind of met a lot of people. So just asking them their input, like what exactly are they looking for in the interview process? And then also when you're in those immersions, the managers they're looking at you. So if you're sitting there and kind of twiddling your thumbs, yeah, it's not going to look good. So definitely be helpful in the unit while you're doing your immersion or even just your standard clinical rotations. And then as far as the Navy, that was a shot in the dark. Like I didn't know anybody. I just put in, my application. I had strong letters of recommendations from faculty here as well. So I'm very thankful for them. But yeah, just use the time that you're in the hospitals now to kind of, let people know who you are and what you're about.
Great. Thank you, Justin. How about Julie?
So I did not get a job through networking, but I did have a good networking experience. So even though I didn't get this job, it's okay. When I was volunteering one day, I don't even remember, it was like at a CPR thing, something. Doesn't matter, volunteer. And I ended up meeting, someone came by the area that I was volunteering and we were talking a little bit and I was saying how I was in nursing school and she was an administrator at St. John's. she had nothing to do with like the nursing side of it, but just the fact that she was an administrator and she liked me, she was like, oh, email me. And we emailed a little bit. And then she was able to get me an interview that it wasn't for a new grad position. So no other new grads were like interviewing for this position. And I don't think I would have gotten the interview without meeting this woman. So even though I didn't get it, it was still good to network in that sense. Still good practice.
Thank you, Julie. We do have a question in the chat from Priya, and they say, there are some hospitals and facilities that I often hear people talk about, such as Reagan, Children's Hospital, Cedars, etc. I am curious if there are any quote unquote under the radar sites where you had unique, valuable experiences that we should think about as we explore volunteer and job opportunities. So maybe kind of like thinking a little beyond just the big name hospitals, other maybe community clinics or health centers that there might be out there that could be good opportunities for volunteering or career jobs opportunities that you can think of.
I think some of the, like when I was looking at research, like I would find out the professors went, like Pomona's Women's Center, we did a research, and I was just so enthralled by, how they connect, because, even Cedars, like their whole mission is about giving back to the community. So it's really important to like look and see where these studies are going and where they're reaching out, and then try and get involved in those places, like the Downtown Women's Center on Skid Row, and like, all these things. And I thought, oh my gosh, this big study is being done, and not just UCLA is there, but Tech is there, and just working for them and being a part of that and getting that experience. To me, I mean, I was lucky to do it as a research assistant, but had I thought about that prior, I'm passing that on to you guys. Just find out like where these people are doing their studies, and then see what you can do to volunteer there and get a part of it and go, oh yeah, I know, Dr. On, you did that great study with HIV back when you were a student on the 8th floor here. And now look, you have this great study that's like, finding receptors that, mimic, AIDS so that the receptor doesn't open, so the pill, works. I mean, he's just like, he's amazing. Like, he's like, come to my lab. I'm bored. Come help me. So I encourage that, volunteering those places. Find out where these people are, we're doing their research at, what centers they are at. Yeah.
Great. Yeah. Any other takes on that?
I have a question
Yes.
after when there's a.
Oh, you can go ahead and ask now.
So for Justin and Stephanie, you didn't do a new grad residency program?
So it's Mount Sinai, they don't have as formal as a new grad residency like UCLA does, but they did give me, like I was the only one new grad on my floor when I got hired, but I did get a preceptor who like mentored me for like 8-10 weeks at a time. And so they had like, it was structured, but not in the sense of where UCLA has set like fall, winter cohorts.
Okay.
So it really will vary by hospital and how they make their new grad program.
And so do you think that those type of programs helped ease you into the workforce from being a new grad going in, as opposed to just getting hired on as a new grad without like a preceptorship or new grad program? Just, with the regular training type of deal.
Yes. I mean, I think for me, like, I just felt like when I first walked into the hospital as a new, I was like, I really still have no idea what I'm doing. So I do think if you could find a place that, whether it's like an official program or at least where they'll give you a preceptor for a good chunk of time. Like I said, I think mine was like 8-10 weeks. It's really, really valuable. Just someone to kind of help guide you through all these very new experiences. And just like kind of show you the ropes, because it's I imagine, very overwhelming kind of getting thrown onto the floor as a new nurse. So it's nice to have somebody that you kind of trust, you can build a relationship with, that you can go to and be like, am I doing this right? Should I be doing this way? How would you handle it in this situation? So if you can do something where you have some sort of mentor with you, and that's a good question to ask in your interviews. Like if it's not as obvious as like says new grad residency,
right,
when you interview, say, hey, as a new grad, what kind of support am I going to get? Or that sort of thing, just so you know. I do think it's important and it's valuable. I don't know, Justin, you have.
Yeah, I would say I would agree with everything she said. Also, I know a lot of new grad programs have protected learning time. So not only are you doing your nursing shift, they'll kind of give you some information, about your specific unit. It's like classroom time, maybe like 4 or 5 hours a week. So definitely look for programs like that as well. But the whole purpose of the new grad residency is kind of, protect you for that first, whatever, how long the program is, and, kind of ease your way in there because they already know you're transitioning from out of school where, some of you are not working, some of you are, and then now you're being thrown in. So I highly recommend doing an actual established new grad residency program. So.
Yeah, as a preceptor, I really feel like you don't know who you're going to get to precept, and luckily you had a very good experience at Mount Sinai. But yeah, I think the new grad program. I mean, Sherry Monsine, was heading that up here at UCLA before she retired, and her heart was in it to make sure that you get what you need. And I can't tell you how many hospitals as a traveler I've been to where they are in the elevator and they're just going, Donna, thanks for asking all those questions in that ECMO class or in that Impella class, or like, you really helped me learn. And then next thing I know, they're like in the elevator going, yeah, it's my last day. I just don't feel like I'm protected enough. I don't feel like I'm getting what I need enough. And I'm just like, oh my gosh, we've let another nurse go. Like they're letting themselves go. They're afraid. So yeah, I think that I'm not sure that you can always get a great preceptor because literally I'm an seasoned nurse and I hear it all the time. No, you take you take the new student. And I'm just like, what? So yeah, if you can be under a nice, well thought out, collegiate kind of, I would definitely jump on that. And like he said, protected is like the number one. Because you don't want to harm anybody. Oh my God, like you're a nurse, you want to help. The last thing you want to do is do something because you didn't know any better. It's like terrible. I sometimes don't sleep at night when somebody dies, I'm like, what could I have done? What did it's a hard mental job. Yeah.
Thank you.
May I ask a
Sure.
follow-up question? Because hi, Dr. Kruger, congratulations. Do you remember me?
Yes, I was looking at you.
I
Yes.
used to be like a big sister to me in the
Aw.
program. So it's nice to see you.
You too.
Thank you so much. So I came to ask a question pertaining to the new grad thing, residency. So that's actually very dear to my heart right now. I am BSN straight to PhD program. So when I was coming to the UCLA program, I had a choice. 3 choices. I could have continued working as a PACU nurse at Southern California Hospital. I just got to my PSN. Or I could have come here to be part of the new grad program, or I could have started the PhD. I had chosen the PhD because it was a 9 to 5, Monday to Friday, and it was clash. So now I got my master's MSN en route, and I'm about to graduate from the PhD. So, but I'm thinking I still want to have this new grad experience.
I know.
So I'm wondering, and it has been extended. When I was coming here, it was going to be a 6 months new grad program in the OR on the transition from PACU to OR. And by the way, Kaiser, I have a Kaiser link, which I was actually working at Kaiser Panorama City.
Oh, you were?
Yeah. Oh, that's what you
Yeah, MOB too.
Okay, wonderful. So I was at gastroenterology, GE, nephrology. So would I be considered a new grad in that I've never really had a new grad experience as a BSN. I got my own first nursing job, kind of networking thing. I had to make a presentation in nursing school. I made a presentation about late Senator McKenzie's cancer. So I went up to the director of telemetry and I asked her, she was a captain in the army.
Oh, nice.
Then it's an army nurse. And I asked her for information. So one day when I needed the job, I went and reminded her that, I'm the one who came and badgered you and all that. And she said, okay, you can apply. And eventually, after a lot of applications, I got a job. So I never really had a formal new grad program. But now I'm wondering, if I get a PhD, am I going to be considered, or you've worked in ER, you've worked in ICU, I worked with an associate degree before I got the BSN. Yeah. So you're not considered a new grad anymore, or is it possible for me to actually get it? Because I have not, since I came to the UCLA program, I've done research nursing. I used to scrubbing surgery with neurosurgery and everything, but they're not really my patients. I'm there to study them, not take care of them. And you know how nurses are. I offer to help, but only if the nurse allows me. I'm not just going to go around and start starting IVs on somebody's patients because they're going to really totally lose it with you. So I kind of miss clinical and I want to go back to clinical again, but I think a new grad training sort of be beneficial.
That's a really good question because honestly, I didn't work while I was doing my PhD and my master's, and it was really hard to get. But luckily, COVID hit. Not luckily, but you know what I mean. And they were desperate, and so I got in by a fluke. And I was like, wow, how did you do that? Because they were desperate for me. But that's a very good question. And we should really look at that and how we can implement something. Because thank you. You shouldn't have to lose the idea that you were a skilled nurse just because you've gone to achieve a higher goal and then you still are so good at the bedside, but you've had no time to reintegrate. I think that's something that needs to be looked at through the HR, but we do have information sessions at UCLA
Okay.
for any, like all these jobs, you know, and I can send that link to you and you can sit in there with the HR and you can ask them, hey, what do you have that could initiate me into this kind of arena, back into this like new grad? So I have that upper level skills now to re-enter it.
Yes.
That's a very good, thank you for asking that. And congratulations, by the way.
Thank you so much. Yeah, my experience, I would.
So please give me your number and we'll.
Yes,
Okay.
I actually lost your number because
So I'll give it to you
I fell
again.
into a pool of water and they couldn't recover my number.
It's a God shot that we're here again.
Once I saw your name, I said I had to come see you.
What do you think?
Yeah, my only other thought was, I don't know if you would be considered a new grad, but I will say when you apply to new specialties, so for example, when I went from med surg to ICU here, like at UCLA, they still put me through a pretty robust kind of new to ICU program. So like I was in a cohort with like 4 other med surg nurses that were new to ICU, and our program was very similar to new grad in the sense of like we had class time, a lot of like ICU focused classes, and then I was again we each had our own preceptors for like 8 weeks. So kind of maybe also depending on what specialty you want to work in or what kind of floor you're applying, I imagine they would, and for sure UCLA, they're very good about orienting and orientation for their new hires. I can't say like for other hospitals, but that's something maybe, yeah, it could kind of depend also. Yeah.
I want to come into OR. When I was coming in initially and they considered me a new grad, I told them I'm not completely inexperienced nurse because I worked in virtually almost every department apart from OB and peds and mental health. So, but they said you've never worked as an OR nurse. So we're going to consider you a new grad for OR nurse circulator purposes.
Right.
Okay.
For that. Yeah, so I don't know, but then it was a 6-month thing and they were going to, UCLA was going to take me, but then I had to make this choice. It was a very difficult choice. I said, I've always wanted to be an OR nurse. And when I really accept what you said about med surg. I came in and they told me, no, we can't take you as an OR nurse. You have to do 1 year in med surg. Then I got into med surg telemetry. So what you said is really true. The time management, all those skills that you learned, really fantastic. Yes. So, but that's what they said. So now it's different. It's become a 1-year program instead of a 6-month program. So I don't know whether they're still going to look at me the same way as they looked at me back then when I was coming in.
Right. Yeah.
But I guess as you said, it's the best.
Yeah, I'll send that to you after the class. Yeah.
And I can get you the contact information.
Okay,
so
thanks.
no worries. Yeah.
Really appreciate it.
And for our last question, in a few words, for all 4 of our alumni that are still here, what does it mean for you to be a Bruin nurse? So I'll give you a couple seconds to think about that one. Think about your time here at UCLA, taking classes here, your colleagues, your clinical rotations, all the experience you obtained from our school and how it's played out for you out in the professional world. How about Julie? What do you think?
I think for better or for worse, UCLA is now the standard, right? So standard in my education, it's standard in my clinical sites. I will say I very much came to love Long Beach Memorial, but when I first started working there, I was like, this is not UCLA. So I think that, it does give you overall a sense of pride to be a UCLA Bruin. But you do now have a new standard.
Good. Buddy in the room, let's take that one.
I'll say, yeah, high standard too, especially when you start out in your first job. People are going to ask you where you graduated from, and once you mention UCLA, their expectations are already high, and they're training you here to meet those expectations. And also just being open-minded. with any ideas. Try not to shut people down. There's a lot of nurses that are they say they're eat their young type of thing, and I still don't understand that. But when you meet new nurses, when you get more experience, just welcome them, and that's what UCLA taught me here. So
Yeah,
mhm.
it's good. I mean, for me, I just love that's it. And I just love to like talk about like all the things that we've developed here. Like I get so excited when I tell people, like, did you know? And especially remember when they had the banners around about all of the Nobel Prizes we've won? It was so cool. Like I was like, yes, that's us. So yeah, I just love and giving back to the community. And these nurses, these professors, if you looked at the hourly rate, if you put the hours that they put in, I probably bet they don't even make minimum wage. I mean, so really my hats off to UCLA. Like they hire amazing people. So I'm so proud to be a Bruin. Oh my gosh. Yeah.
Thank you.
Yeah, I feel like just a very high level of standards and professionalism. I can't tell you the number of patients that I come across that are like, the nurses here are amazing. Like patients always speak very highly of the nurses. And I think the nurses that work at UCLA, myself included, just really enjoy it. It's a great place to work. And it's kind of like a very strong mutual kind of relationship between nurses and the hospital. Yeah, I just think UCLA nurses are great. And I feel like most people I come across enjoy their work and enjoy working at UCLA. And that's important too. Don't work at a place you hate because it's really going to burn you out. So
yeah, and you came from Mount Sinai. I mean, that's a great place for you to compare us to. I remember doing a travel assignment at Johns Hopkins. And to this day, I will say to people, I consider UCLA right up there with Johns Hopkins. I mean, the things that I did there as a travel nurse and the things that I did here as a travel nurse, I mean, they are like right in sync with each other. So, that's pretty high level. I mean, Johns Hopkins to me is just amazing. And to see that we actually on the unit do the same type of rounding and communication and hearing and collegiateness, I just love it. So I've been to a lot of hospitals and UCLA is like amazing. Like I said, it sets the standard with like, as far as I'm concerned, with Johns Hopkins. And that's impressive.
Wow.
Yeah.
Amazing. That is great. Alrighty, we are over the hour by 7 minutes. Thank you everyone who joined us today. Round of applause for our 5 alumni. Yay. So yes, please join us next quarter for our next alumni panel. We do have an alumni panel every quarter, so stay tuned for our updates. Have a great day, everybody. Thank you.